All right, so this morning we're privileged to have the government statistician join us once again on the back of the release of yet another report on the 2021 Population and Housing Census, detailing some interesting findings. For instance, 60% of the population, or 18.6 million of us, fall within the working class. That is those aged from 15 to 64. But how many of these are employed? There's also the district with the most people, and guess which district came tops? Kumasi Metropolitan. Professor Samuel Kobna-Enim is on the AM show today to point out some very interesting highlights of their latest report. Good morning to you, Prof. And welcome to the AM show once again. And thank you for making time to come speak with us about the Population and Housing Census, 2021 Population and Housing Census. Now, the last time we spoke, you indicated that over the next few months, you're going to be releasing various reports that will bring us a lot more detail. So we have the overall picture, but then you're going to be breaking it down. And so today we have an opportunity to go through another bit of it. So in a bit, I'll let you walk us through what makes this one very interesting. So there are 3 volumes apparently that were launched. So we have the volume 3A, Population of Regions and Districts, and then we have Age and Sex Profile, and we also have Background Characteristics. All right. So I'd want you to, take it away. I don't know where you want to start from, but there's a bit of it that makes this conversation very interesting, which has to do with the way the population is structured, as in the age brackets. And it often tells a story, and it gives us an indication what we're supposed to be doing, because really that's what these statistics, or that's what makes these statistics very, very, very important. So let's start with that, shall we? What is the structure, or what have you found to be the structure as we speak?
Thank you very much, Israel, but permit me to just put this response in a context so that as we've planned the releases, we want persons in Ghana to absorb the census results in a certain sequence, because it has implications for policy discussion. So as you rightly said, on 22nd, we did the preliminary report, which gave us the provisional results. And on the 19th of October, we did the proximity to essential services report, which walked us through the areas that are deprived. The general report would come in 11 volumes, and as you've indicated, yesterday's event was to release the 3 first set of volumes out of the 11. And the focus was on the disaggregated information around the population size, the household size, population density, the shares across the regions, and also the districts. And the volume B, as you rightly indicated, is the age-sex profile, which would provide a response to the question that you've asked. And the third one is the background characteristics. So in terms of the age-sex profile, let me indicate that it's one of our 5 highlight stories from the 2021 PAC release that we did yesterday. And why we say that is we did comparisons at different levels across the 3 age brackets: children, the working age population, and the elderly. And as you rightly pointed out, 60.4% were within the working age bracket between 15 years and 64 years. And we got 4.3 for the elderly, that is 65 years and above. And the children, we had 35.3. The second comparison that we did was to look at how this has evolved over time. So essentially, we compared the population, the 2000 population housing census with the 2021 population housing census. We did little with the 2010 population housing census because this age structure takes quite some time to change significantly. So over the 21 years, we observed that the children age bracket and the working age bracket have moved in different directions. And what I mean by that is, while we saw a decline in the children population, that is the 0 to 14, from 41.3% in 2000 to 35.3% in 2021, indicating a 6 percentage point drop. The reverse was the case in terms of the 15 to 35 age bracket.
Okay.
So the 15 to 35 age bracket had increased by 3.7 percentage point over the 21-year period, moving from 35.3 to 38.7.
What does this say, or if you happen to be a government official, what will you make of this this particular highlight of it?
I must say that we have worked to this extent, having timeliness of statistics in mind, and we were so delighted to have seen the census results make its way into the 2022 annual budget.
All right.
Because we wanted to meet the November deadline for the Ministry of Finance to provide them with some statistics. Definitely we could have provided them more, but initially we said to them that this is our observation, and I think that is one of the things that led to the thoughts around the investment around for youth. Because what this is telling us is that we need to now begin to invest in the youth. Because if you are seeing a transition from children to youth, eventually this transition will go to the
Adults.
elderly.
Okay.
We call it elderly, and because this is the 65
dependents.
Correct. So one of the things that we found in the 2021 PAC is the age dependency. Now, for those in the working age bracket, that is the 15 to 64 years, every 100 of them would have or are expected to take care of 66 dependents. That is the children 0 to 14 and the 65 years and above. With this transitioning occurring over time, we expect that this 100 taking care of 66 is going to go up, because the transition would continue to see a bigger bracket for the elderly.
So let's take our time and break this one carefully. So you're saying that every 66,
every 100 persons within the working age bracket, 15 to 64 years, are now expected to be responsible for the dependents 0 to 14 and 65 years and above. That is what the current population age structure is telling us.
All right. So it looks like it this way, but then we'll give ourselves 20, 30 years and it's going to change.
Yes, that is, with the transitioning that is happening from the children to the youth, the expectation is that, holding all the other things like migration and mortality constant, the expectation is that the elderly age bracket is going to increase.
So the elderly age bracket, or those who are becoming dependent, will increase, and there will be more than the people who will be available to take care of them.
Exactly.
All right. Even though, of course, if you're looking at it in detail, there will be somebody who will be taking care of maybe 5, and not the average that we're looking at right now. Okay, so that's very interesting. Which then means that it is important that we take care of the people or invest in them right now, so that they would have enough resources, so that when they find themselves at that stage, they're either taking care of themselves or taking care of the people who they're dependents. Okay, so that's one interesting aspect of it. But another bit, and if we stay on the working class group again, so we're having about 60.4% of the population falling within the working class. Is the census able to tell us whether these 60.4% actually are employed? So,
as I indicated, we're going to have 11 volumes. The volume E of the general report is going to focus on economic activity. We're working towards releasing that hopefully before the end of the year. And from that economic activity volume, we'll know of the 15 to 64, those who are employed and those who are not.
All right. But typically, this is we call them the working class, but it's more like the mass. Even because there are people who may be less than 15 years who are working. And there may be those who are above 15 years who are actually working, even though they don't fall within that category of working class.
So what we do for our censuses and for surveys is to get a sense of children who are working. So the data collection allows us or we go ahead to collect data 5 years and above to see those who are engaged in some form of activity. But when we are calculating our employment, unemployment, we go by the law which says that it should be 15 years and above. But then again, in that economic activity volume, as I indicated, we will give an indication of less than 15 years who are working.
Right, and all this, the statistics we're sharing, or the statistics that's available from the Ghana Statistical Service, also aids businesses and investors. They're looking at all the figures and they're deciding that, okay, if there's a working population of this much, if I'm coming in to invest, I'm looking at investing or tapping from this size of the working population to in my business.
So one of the things that I would want us to highlight from these reports is around the issue of urban-rural, which we didn't see in the provisional and also in the proximity analysis, but is prominently featured in these 3 reports that we've shared. First is our understanding of what urban is and what rural is.
Okay.
As a country, unfortunately, we always come to this discussion every 10 years. Moving forward, we need to find a way of updating that data on urban-rural depending on the definition that we put to it. So traditionally, we've defined urban-rural based on a population of 5,000. So once a locality has a population of 5,000, you declare that locality as urban.
Oh, is that all it takes?
That is all that it takes. I mean, that is what we've done in previous censuses.
Okay.
But this is a definition that people have looked at it with some concern, because once urban, once rural, one would want to reflect the facilities that are
availability of social amenities,
correct.
For instance.
So from the 2021 PAC, in addition to population 5,000, which is the cutoff for urban-rural, we added availability of essential services. Specifically, we looked at 4 dimensions of essential services. One is whether the locality has a junior high school, whether the locality has a health facility, and health facility, we look at it from clinic and above. And then we look at it at the household level in terms of the proportion of residents that have access to electricity and water. So these are the 4 dimensions that we've added to the population in the definition of urban-rural. And that tells us a lot of different stories from what we've seen at the national level. And one has to do with even the population growth rate that we are talking about. While we see a national 2.1 population growth rate, we see a wide variation between urban and rural areas. We've seen urban areas talking about 39.3% of the change in the population growth rate so this is the change, not the annual. The change in the population growth rate between 2010 and 2021, 39.3%. National is talking about 25%, and rural areas 10.8%. So you see that variation. Between 2010 and 2021, nationally, our population has changed by 25%, from the 24.6 to the 30.8.
Yeah.
Urban-rural, the change is talking about 39.3 and 10.8. And then once you go into the regions in terms of urban-rural, there's stark variation between northern region, which is recording over 100% change for urban areas, right down to Bunu East region, which is recording about 25.8. So the urban-rural dichotomy gives us a lot of revealing stories. Once you add the facilities to the population, regions such as Western North Bunu, which were classified, Bunu East, which were classified as urban with a 5,000 population, will change their status to rural.
Yeah.
And at the district level, you find district like Pru East that would have about 63% urban, but once you add with the 5,000 population, but once you add the essential services, it completely moves into as a rural district. So the essential services that we've added on to the definition of urban-rural is confirming the results that we got from the residential to proximity analysis.
So let's look at the rural-urban again. How many, which segment of the population, or what percentage of the population is in rural and which percentage is in urban?
At the national level, we have 56.7% of our population living in urban areas, and the complementary is 43.3% living in rural areas. But as I indicated, our focus is, has this transitioned over the period? And indeed, it has transitioned. Ghana became urbanized from the 2010 census, when we had over 50% of our population being, specifically 50.9 of our population being living in urban areas. And this now has increased. So we've added on from 50.9 to currently 56.7 at the national level. But again, we emphasize the deviations across, or the variations across the regions. You are seeing 91.5% within Greater Accra of persons living in urban areas, right down to 25.4% in the regions in the northern part of the country. So the urban-rural discussion is not only being discussed at the national level, but how the variations show themselves up at the regional and the district levels.
Interesting. Let's go through some of the other interesting findings that you made in this latest report.
So one of the things that we talked about from the provisional results, which we've looked at it differently from the general report, is the issue of population density, which we talked about at the national level and at the regional level, which is simply the number of persons that live in every square kilometer. It would be recalled that nationally it was 102.3 in 2010, and now we're talking about 129. So at the national level, we've added on 26 persons for every square kilometer. Again, if you look at this at the regional level, there's a lot of variation. In Greater Accra, for every square kilometer over the 11-year period, we've added 445 persons for every square kilometer. Whereas in Savannah, we are adding on only 5 persons for every square kilometer over the 11-year period. The issue of population density becomes worrying if you look at it at the district level. While in Greater Accra as a whole, we talk about 1,681 persons for every square kilometer, there are some districts in Greater Accra, the Ayawaso North Municipal, as an example, that holds more than 33,500 persons for every square kilometer.
So they are more densely, if you look at it district by district, then you realize that there's some particular districts that are a lot more densely populated than the others.
Indeed, but Israel, my major concern here is the implications of the numbers. Think about a regional average of 1,681 persons for every square kilometer in Greater Accra, while in a district, you are talking about 33,580 persons per square kilometer.
It must certainly speak to the fact that there may be a lot more people crowded or cramped in, and then you're likely to see slums in these areas.
Correct. Correct. And as I indicated, this has a lot of implications, including health. The outbreak of any disease and the extent to which it's easily going to affect people in the locality and its implications thereof.
And then for these densely populated areas, the question then is, do they have enough amenities to serve the people within that district? Is that something? What did you find out, for instance?
I mean, this is essentially what we are doing with the proximity analysis, and that is why in the proximity analysis we identified such areas. What we've not done at the moment is at the district level to relate the essential services to the population. Yeah. But these are the things that we are going to come up with once we start doing the thematic and the analytical reports.
Okay, so we have the density at the district level on your screens right now. So the most densely populated district in the country, as is indicated, is Ayawaso North Municipal, where, as you're indicating, we have 33,583 people. And then followed by Old Tafo Municipal, where we have 20,880 people. And then Ablekuma Central Municipal, that's 19,116. But clearly, going back to the Ayawaso figure, even if you compare Ayawaso North Municipal to Ayawaso East Municipal, clearly you can tell that it is
about twice
the number of people. And then you go down to, I guess, the least populated, densely populated, and Setra Farm Plains. You have 9 people per square kilometer. Life must be good for them.
I mean, if I can speak to this a little bit, because this is where we need to relate the proximity to essential services to the population density. Yeah. During the proximity to essential services report, we did observe that Sechua Plains is one of the districts that are deprived from both health and education point of view. And that is why from that report, we indicated that we should begin to think about our settlement arrangement. So it is not densely populated. So, and that doesn't mean you need to conclude that they are better off in terms of welfare.
Yeah.
Because from a proximity to essential services point of view,
that would be a challenge.
We did observe that they are deprived. And that's why we are saying that we cannot continue to settle in pockets of areas in the country, because the government cannot simply decide to locate these essential services anywhere they find people settled.
Now, this is very interesting. So what is being done, essentially what you're saying is, if we're going to use this one for, planning purposes, government will decide that you can't go and live in an area that doesn't have. So some places should not be, livable or residential areas. Stay around places where, so we will locate, government can decide that we're locating social amenities in a particular district. Stay around this area. If you go beyond, we can't serve you.
Yeah. I mean, that is one of the highlight statements that we made to the president when we did the update from the proximity report. We said that as a country, we need to begin to think about what are the processes for settlement, what are the conditions for settlement, and what are the enforcement rules. Because especially in the northern part of the country, you see a lot of pockets of settlement, and as I indicated, government cannot simply decide to cite these essential services once somebody is there. It's simply not possible. So there should be some planning around how people settle, and indeed it's the MMDAs that would have to lead this discussion.
And it also brings me to an issue, a conversation I've been having with lots of people, and which is a real problem for most parts of Accra. So there are some far-flung areas in Accra where people decide that because there's a housing challenge and I can't afford to buy land in the developed areas, I'm going to a place that's far off, I'm going to get the land for cheap, and I'm going to move there and build. And hope that development comes to me. But then they go into those areas and then they realize that it's taking forever. Then they start agitating for roads, and they start agitating for electricity, for water. But it's like they are moving and depending and expecting that the development will come to them. That shouldn't be the case. It
doesn't have to happen that way. We need to plan development in any new area that people decide to go in there. And as I said, this is strictly the responsibility of the district assemblies, because if the government is operating with a particular plan for developing areas in the country, and that is not consistent with where people decide to move, we're going to have that divergence, and nobody has control over when the development is going to come to where people have decided to go and live. But once we are planning settlement in the country, then they wouldn't diverge, they will converge. And at any point in time, government will know where to site these essential services.
All right, so let's move on to the next point after dealing with the population density at the district level.
As I indicated, we had the background characteristics as well. While this might be more of a social issue, which indeed we are doing for the first time with a particular interest, is the issue of marital status. And here we focus on the category that are married and disaggregated it by the marriages that had been registered and those that had not been registered.
Okay.
And this was done with the mindset that it gives a sense of the protection around the marriage for whatever reason that one would want to put to it. And it did come up that of the 80% of the marriages that were recorded from respondents, they had not been registered. And
80%?
80%.
80% of marriages not registered? Not
registered. And again, we saw this varying both across the regions and across the urban-rural areas. And as a head start, we are saying that this is the first time we are doing this. This is the first time this observation is coming up with this stark variation between registered and unregistered marriages. And we are looking forward to the Ministry of Children, Gender and Social Protection to take this up, because we really need to understand why these marriages are not occurring and whether it's an old age phenomena or it's a recent phenomena, right. And then begin to think about the implications thereof, especially when you are thinking about when one becomes widowed and when one becomes separated, the implications related to the registered and unregistered marriages.
When you say whether the ministry needs to find out whether it's an old age phenomenon or recent, essentially the point you're making is whether these unregistered marriages occurred in the past when probably they didn't have access to facilities or registries, or whether it is happening now where people have access and yet they don't think that they should.
Correct. This is exactly the point, because if it's an old age phenomena and for over time it's improving, then we'll say we are making some progress. But if it's something that is occurring in recent times, all that we need to do is whether marriages that occurred 30, 40 years ago, the proportion that were registered, unregistered, vis-a-vis marriages that have occurred in the last 5 years, the proportion registered or unregistered. That gives you a sense of the possible causes that are accounting for the 80% of the marriages that are not registered.
Okay, so even though 80% of the marriages are not registered, this 80% would also include the marriages that fall under traditional marriage, right? As in, people taking drink to a family and saying, I'm marrying this person. So the traditional marriage will be recognized, even though it is not registered.
Yes, so here we are talking about registered marriages that has followed the procedure of the Registrar General Department.
And ideally, you'd expect that some of these the traditional marriages will also be registered.
Yes. Once we talk about a registered marriage, then our focus is on, as I indicated, the Registrar General.
So that's at the national level. 80% of the marriages are not registered. When we get into the regions, what sort of picture are we looking at?
So we see this varying from the Greater Accra region, which shows a lot of the marriages that are registered relative to the northern part of the country where the marriages are not registered. So, for instance, in Greater Accra, you have about 59.9% of the marriages that are not registered, right down to northern region where you are talking about 97% of the marriages that are not registered. So the 80% is within the 80% is within 97.1 from the northern region to 59 in the Greater Accra region.
And then I see that you also did the urban-rural segregation.
Yes. So again, the registration is happening more in urban areas, and as I've been doing, I always want to put emphasis on the numbers rather than just saying it's more. Okay. And here we are seeing about 3 times difference between urban areas and rural areas, where only 9.3 of the marriages are registered in urban areas relative to 27.3 in the urban areas that are registered. So we see a 3 times difference between urban and rural areas.
And then I also see that you've broken it down to urban male, urban female. When it comes to registration, it's a couple. So why the differentiation between male and female?
The couple is an expectation, but we all know that there are multiple marriages, because one male would have 1, 2, 3, or the female 1, 2, 3. So this is the twist that it is to the urban male and urban female.
All right, that is interesting. Okay, so let's move to from registration of marriages. Which other point do we go to?
We looked at other issues within the background characteristics, i.e. health insurance coverage, and we did observe that 7 out of every 10 persons or respondents that we had was under a health coverage. Again, this varied across male, females, and also varied across
7 out of 10.
10.
Which is significant. 70% of the population coming under health insurance coverage is significant, would you?
Yes, but I am always careful with some of these statistics that are also generated by the institutions that are responsible for these issues. So, for instance, if one is looking at health insurance coverage, and the perspective one is looking at it is from those who visit health facilities and whether at that point of visit they had a health insurance coverage, that response will be different from doing a population-based survey, census. Because once you are doing a population census, you are visiting all persons in the country, whether they've fallen ill or otherwise, and asking them whether you have coverage or not. But once you are talking about people who visit hospitals and you are capturing the data based on whether at the time of the visit to the hospital they had coverage, that sample is biased because they will definitely not capture those who are not ill but are part of the population. So if, for instance, I have a chronic ailment and I have to visit the hospital and whatever it is, it's under the National Health Insurance Scheme, then I would make sure I have it, and anytime I go there, I take advantage of the cover. That person who is not ill will never visit the hospital, and that person will say that in the last 40 years I've not fallen ill, why do I have to even get a health insurance? So that person would not be part of the cover, and that person would also not form part of the sample. So although we've seen in other surveys, and again other institutional-based surveys with higher percentages, I'm always encouraging the need to look at these numbers based on the respondents that are giving the responses. But from the 2021 PAC, we are seeing 7 out of 10 persons that have coverage. And here coverage is not only health insurance, that is the national health insurance, but any form of health insurance. So one would expect that the percentage might be slightly lower once we look at it only from the perspective of national health insurance.
But then would it also mean, or could it also be that, okay, so someone has more than one coverage. So I have private and I probably also have public as well.
Yes, I mean, that is there, but emphasis here is whether you have either private or public. But indeed, once we are doing the detailed analysis, we're going to distinguish between private and public.
Okay. And then again, also in this instance, we see that in the urban areas, or there are some regions that have more coverage than others. So if you could just walk us through that. So
before we get to the urban, rural, the other disaggregation is the female-male, where we see more females having the cover than males. So females had in excess of the 70% national average relative to males that had specifically 65%.
Why do you think that is so?
As a statistician, I'm always careful adducing reasons to some of these findings, and especially when we're going to do the thematic and the analytical report, you have to veer away from.
Stay away from that. Okay, but that's interesting. So essentially, more females, we have more females having
the cover, insurance cover,
as compared with males. Oh, that's interesting. Okay, so then let's go to the rural urban.
No, the regional. Now we did it at the regional level. The regional level, we see that variation between Upper East and OT region. OT had the list of about 52.1% of the residents that had the cover, relative to Upper East that had 86.4%.
So Upper East has more people who have insurance cover, you know, by way of the population, the percentage of the population, than Greater Accra.
Yes. Yes.
Where I mean, you actually think that Greater Accra people would have more access to the health insurance than, you know, Upper East, which is supposed to be more rural.
So these are some of the things that, as I indicated, we'll see in the thematic report, but I would go against what I said earlier on and try and make reference to the proximity analysis and see if we could see some relation in terms of the presence of health facilities in Upper East relative to the other regions. From the proximity analysis, it was clear that Upper East is the region that had the highest proportion of the population or living in residences that are closer to health facilities.
Okay.
And this has been argued from the perspective that the concept of community health based health facilities,
the CHIPS compound,
started in the Upper East region, and that is where we have the dominance of this in the country. So one can surmise that we are seeing Upper East having a higher coverage because it's supply, what we call supply induced, because these facilities are there.
They see the facilities,
yes,
and
people
so they
go
want to
in
patronize.
to do that. So that could be one of the possible reasons why we are seeing the highest coverage in the Upper East region.
So it starts from the Upper East region topping, and then we have the Bono, and then Upper West, and then Bono East, and then Ahafo, and then Northeast, Western North, Eastern, Ashanti, and Oti being the region with the least, coverage when it comes to health insurance. Okay. All right. So let's move on to the next item. Other exciting item in your findings.
So this is an issue that we think would tickle the interest of different stakeholders, and that is the population 18 years and above. I mean, it has implications for our elections, it has implications for other issues. And
once you talk about elections, then yes.
Yes, so we did find that we have 58.2% of the population that are 18 plus. And this 58.2% of the population that are 18 plus, again, varies across urban, varies across the regions, and definitely varies across the administrative districts. Anytime we talk about this, we are careful in the sense that whatever you want to relate it to, anytime that relation is going to happen, that is 2 years' time, you need to think about the population 16 years and 17 years, because these population groups are going to get into the 18-year bracket. So we are putting this figure out there that 58.2% of our population are within the are 18 years old and above. But again, this varies across the administrative regions.
So 58.2, and what's the figure? If it's 58.2 of 30.8 million, and then it gives us the voting population, essentially.
So it's 17.9 million out of the 30.8. So we are talking about 58.2 as a percentage of the 30.8 million, and this comes to 17.9 million.
Right, and then if you look at it into detail too, then regionally, so we're having Greater Accra with the population with the greatest, with the population size, with the highest population, voter populations, as you can say. And then Bono, followed by Bono, and then Eastern, and then Volta, and Western, Ashanti. And then the least is Savannah. Okay. But that also speaks to, okay, not quite. I thought it was going to speak to, okay, so then let's go on to the...
So one thing I want to talk about here is the, as I've been doing, is the extent. So yes, we have regions that are higher, that have higher proportion of the 18 plus population, but between the highest and the least, you are talking about a 13% difference between the Savannah region and the Greater Accra region. So Greater Accra region has 64.6 and Savannah has 51% of the population 18 plus. So this variation in the 18 plus has implications, as I indicated, for a number of stakeholders that use the 18 plus for either marriages, either elections, and so on. Yes. From the age structure point of view, we did find some deviations, as was indicated during the provisional results. Females dominate. 50.7% of our population are females, and 49.3% are males. We see differences once you do the urban-rural variations, and also once you do the regional variations. And one of the things that we said strongly during the provisional is that in spite of the national picture showing females outnumbering males, we have 6 out of the 16 regions that showed males dominance over females. But what we are seeing now is the urban-rural distinction. The urban pattern is consistent with the national pattern. So in urban areas, females outnumber males by 5%. Whereas in rural areas, males slightly outnumber females by 0.3%. So the picture in the rural areas is different from what we are seeing at the national level, where we see males outnumbering females. And again, this is consistent in the 6 regions that that showed the male dominance. The point that I'm driving at is that while the age bracket less than 20 years expect to see male dominance, because we expect that we have more males at sex ratio at birth, sorry, we have more males than females. We see Greater Accra as an exception. So across all the 16 regions, we see the under 20 years having more males than females. But we see exceptions within the working age bracket in some specific areas of the country, i.e. Western North region and Western region, where we see that the population 30 to 64 years, which is predominantly the working age bracket, which spans 15 to 64 years, where in all other regions except Western and Western North, we see male dominance there. And one of the things that we think might be accounting for that, and again here we are talking about 30 to 64 years, which is predominantly the working age bracket, where in all other regions, with the exception of these 2 that I've talked about, we are seeing the male dominance. So what is possibly accounting for that could be what we should be expecting in terms of labor migration and the type of economic activities that are ensuing in these areas. From our point of view, this has a lot of policy implications, because once you are seeing male dominance there, the interventions that you would want to give to females across this age bracket would have to be tweaked a little bit, because in these areas we are seeing male dominance for the 30 to 64 age bracket.
And the area, or the Western North, which you're saying that has the population, the men outnumbering the women. I recall the last time you were here, you mentioned a reason why that would be so.
Sorry, say that again.
The Western North, which is the region that has more males than more females, or with
yes.
most males.
Yes.
You mentioned one particular reason, you ascribed a reason.
Yes.
If you
so this is exactly what we are trying to confirm now. So overall, Western region has males outnumbering females. But now what the details that we are giving is which age bracket shows the male dominance.
Okay.
So it is not across all the age bracket.
Right.
So in my previous engagement, we did indicate that it's possibly labor migration that is accounting for that. And now we've narrowed down on that reason, having found out that it's the age bracket 30 to 64 years that have the male dominance. Otherwise, the 65 plus, you see the female dominance, yes, and also
reflects the national.
Yes, which reflects the national picture. And also below the 30, you see pockets of the female dominance, or essentially no difference within the Western North region. So it's gone back to confirm the earlier suspicion that it is more of the labor migration that is accounting for the dominance of males in the region than females.
All right, thank you very much. I'm sure if we had a lot more time, we were going into a lot more, and statistics, they say, very interesting, because it tends to throw up a number of things. But one of the things that stands out for me is what we need to do as far as the youth is concerned, so that we can equip them right now, so that when they get to that age where they have to be catering or taking care of a lot more people, they are in a much better position to. All right. Is there any final thing you'd want to say before we wrap up? So
we did indicate that this census would at least bring to us 2.6 million indicators. And clearly, as you rightly said, there is a lot more. In addition to the transitioning that you've talked about, Israel, I think as a country, we really need to focus on the urban-rural discussion. It is showing stark differences. We saw that during the proximity analysis, and clearly with the population profiling that we've done in terms of the sizes, the household sizes. I mean, the household sizes, we are seeing a variation of more than 4.3 persons between the district with the highest population, with the highest household size, and the one with the least. This has a lot of implications for housing and so on. So we need to really begin to concentrate on the disaggregates And that is where the issue is. What is happening at the district level? What is happening between urban and rural areas? So that disaggregation calls for a lot of policy discussions.
At the end of it all, it's government that has to take these statistics and work with them and do something with them. And we're hoping that they're doing that.
No, I'm pretty optimistic that they are doing that for two reasons. As I said, we made sure that we get the results on time to feed into the budget, and thankfully it fed into the budget. Now we are hoping that the implementation thereof will reflect whatever has been indicated. Yesterday during the lunch, across all the 3 volumes, we identified the Ministry of Local Government, Decentralization and Rural Development as the lead government agency or ministry responsible for all these findings. And thankfully, the deputy minister was there to chair the occasion. We've handed over this to them.
Right.
I've already initiated discussions with the minister to hold sessions with all the regional ministers and subsequently with the local government services. So from our side, our goal is to increase the uptake of the data use, and we'll do all that we need to do to ensure that we have the necessary use.
Okay. All right, thank you very much, Professor Samuel Kobna-Enim, who's the government statistician. He's been taking us through the latest volumes, reports that they have from the 2021 Population and Housing Census, and we'll continue having these conversations and expecting that a lot more work will be done, or the government will take the information and work with them. So thank you very much for coming through once again. You're still here on the AM show.